Good afternoon, everybody. I just want to start by saying thanks to the thousands of Manitobans that have signed up to volunteer on the Help Next Door MB website. We got 140 communities represented by volunteers, and they're helping dozens and dozens of people right across the province. And I am so proud of all our community partners and all Manitobans for stepping up and helping other Manitobans in this time of stress and time of need. I want to mention young people like Gwen, who with the help of her mom, Jasmine's been spending time handing out free groceries in Winnipeg for those most vulnerable. Or Victory School in West Kay that have been asking students to thank our hardworking frontline workers by making signs and displaying them in the windows for all Manitobans to see. That's the spirit Manitoba, and Manitobans working together, helping each other, helping their neighbors, taking every precaution necessary to protect themselves and others with the health advice we've been given repeatedly and must take. I also want to say a special thank you to all our frontline workers, our emergency personnel, teachers, great reports of teachers adapting to the stress of instructing in a new and different way and innovating in doing it. Congratulations to you. Small business owners, all Manitobans, for continuing to do what you can do to flatten the curve. These are uncertain times, but we'll face those challenges together and we'll beat this thing together. Pendant cette période, nous aimerions féliciter tous les travailleurs de première ligne, le personnel d'urgence, les enseignantes, les propriétaires de petites entreprises et tous les Manitobans de continuer à faire ce qu'ils peuvent pour aplanir le courbe. I think this is, as it has been for our government, and I think certainly as it has been for the communicators on the front line, and I thank Dr. Brent Rusin. I think he has done a great job of keeping us informed. Candor is better than mincing words. So let's talk about some things that need to be talked about. Economic activity is vital. It's commerce, it's business, it's trade. It's vital because it creates jobs and employs people. It's vital because it pays our government's bills too. And it obviously plays a role in providing the services that we all depend upon. That activity generates taxes, business income taxes, sales taxes that the buying and selling of goods and services generate are used to support Manitobans. They are the government's income. That is called what we call revenue, what you would call income. So let's be frank. Our revenue is down. Not a little, a lot. Way down. Now, in our first term, your government began to build up the rainy day fund. There wasn't much in it, and we began to save. In challenging times, we began to put a little more money away for the future, and good thing we did, because our rainy day savings over the past 4 fiscal years add up to close to $1 billion. And that money is beginning to be put to excellent use now, responding to this historic worldwide pandemic, and its impacts on Manitoba are being felt throughout the province. We're making the necessary investments to protect our healthcare system and all the other important services that are key to keeping us safe. But as our income as a government drops and as our expenses rise, that rainy day money will get used up. And I have to be frank with Manitobans and say, although we've worked very, very hard to build up that cushion, our funds could be gone in 3 months or less. And should the situation deteriorate further or faster, that savings fund will be used up even sooner. Now, should that happen, we and virtually every other Canadian province will need to borrow more money to protect our healthcare system. There is no choice. And so today, I am calling on the federal government to establish a pandemic emergency credit agency, which will borrow funds on behalf of all Canadian provinces. These funds would, of course, be repaid by provinces, but because of the federal government's size and its relative fiscal strength, as noted recently by the Parliamentary Budget Officer, the federal government will pay far lower interest costs on its borrowing than Canadian provinces will. Aussi, aujourd'hui, j'exhorte le gouvernement fédéral à créer une agence de crédit d'urgence en cas de pandémie qui empruntera des fonds au nom de toutes les provinces canadiennes. This is the time to unite. This is the time that we save money in the billions of dollars, potentially, by borrowing smarter. These savings will be put towards protecting our healthcare system for us today and for future generations. Stronger banks or stronger healthcare, the choice to me is obvious. The federal and provincial governments have been working effectively together, and I thank all my colleagues across the country and at the federal government level for that commitment to teamwork, to deliver on the promise of coordinated protection for all Canadians. That must and will continue. This is a Manitoba idea being advanced from a common sense province that is another way in which we can demonstrate our respect for and our willingness to focus on the healthcare system for all Canadians today and tomorrow. Manitoba has been the home of hope for over 150 years and will continue to be the home of hope. We can beat this thing together. Thank you. Any questions?
Thank you, Premier. Just a reminder to reporters, you get a primary question and then a follow-up question. First up will be CTV Jeff.
Oh, hi, Mr. Premier. First part of my question, why not, if we're in tough financial times then, why not cut that PST decrease and does this change your deficit projections?
Well, the PST decrease won't happen this year. It's extremely doubtful that we'd have all-party agreement to proceed on that in any case, so that's irrelevant. The PST money, when it is reduced, will go onto the kitchen tables of Manitoba families at a time when it's particularly going to be needed there, but that's not going to happen this year. Having that PST money would give us about 4 days of extra latitude on our rainy day cushion, so this is not the issue. The issue, frankly, is the billions of dollars potentially that we'll need to borrow here in Manitoba, and tens, if not hundreds of billions of dollars coast to coast, and the billions of dollars we can save in lower interest charges that we can put towards health care if we use the agency I'm proposing and the lower credit charges that the federal government would incur.
Okay, a follow-up. People are wondering when an announcement on essential services will come from your government. For example, funeral directors are wondering, will their businesses be considered essential services because they want access to safety equipment, things like that? And I mean, will you be making announcements on certain businesses can stay open and others can't?
Yeah, we've had discussion on that as recently as a couple of hours ago with senior health officials. There are numerous details we need to iron out very quickly, and we're in the process of doing that so that we don't create confusion in the private sector or elsewhere, for that matter. And also out of respect for people who work in these and other private sector businesses, it's really important that we do our best to get this information out clearly and correctly. So that's exactly what we're focused on doing. At some point, I'd say, Jeff, in the next few days, we'll be able to get greater detail out to all our private sector partners around the province.
You
bet.
Next will be Jill from CTV National News.
Premier, it's Jill McIntyre with CTV National News. We know the federal government is going to say we've just dumped, $100+ billion into this COVID crisis. you know, we also don't have the funds to be beefing up healthcare in the provinces. What exactly are you looking for, and what are you hoping the response will be?
Well, we're not asking for the federal government to increase its costs. We're simply asking for it to act as an intermediary so we can use its credit rating in order to pay less on borrowing. This is not a handout program. I'm not banging a tin cup here. What we understand is the federal government can borrow at least a percent point more less than we can as a province right now. Other provinces are in a similar boat. That's today, but as the liquidity crunch kicks in, and it's kicking in, the difference between what the federal government can borrow money at and what the provinces would have to pay will grow. And as it grows, those dollars, extra dollars every province will have to pay separately, are taken from healthcare and given to banks. So let's let the federal government act as an intermediary. It can coordinate the borrowing, satisfy the need for liquidity in the provinces that's going to exist. This is not today, Jill, but this is something that's going to be needed out there in the future. I can see it coming. I think many Canadians can too. And so, you know, stronger banks or stronger healthcare, that's your choice, and I know what my choice would be.
And this is a follow-up when you talk about stronger healthcare. You're talking post-COVID, and what are you exactly looking for in terms of more nurses, more doctors, better hospitals?
Well, yeah, all those things. Our expenses are up, and they're going to continue to rise, not just in the healthcare sector, but that is our first and foremost concern. Look, the issue isn't, again, the issue isn't asking the federal government to give us money. I'm asking the federal government to give us the benefit of their lower borrowing costs so that we can get the money we're going to need to operate our healthcare system effectively, dealing with the pandemic. And remember that there are many, many other challenges that we're going to face as a consequence. I'm going to speak a little bit more tomorrow about some of the mental health aspects. That's one, but there are dozens of others. So again, I want to be very clear. This is about simply smarter borrowing.
Next will be Drew from the Brandon Sun.
Thank you. Mr. Premier, how much would you see the province as needing to get through this? Like, how much would you be asking the federal government to borrow here?
Well, of course, I can't speak for the other premiers on their needs, Drew. The cumulative need, though, would be, I expect, easily into the tens of billions of dollars. Here in Manitoba, we anticipate that we could easily, by the end of the year, we could easily reach 10 billion ourselves. We're about 4% of the national economy. And so if you did the simple math, you'd say, well, multiply that 10 by 25, there you go. You know, you're talking about $250 billion. The interest savings on that, if borrowing at the federal government level versus our current best borrowing, is over a percentage point savings. 1% doesn't sound like much, except if you have a mortgage, then you understand what it sounds like. It sounds like a bigger bill, right? Well, this is the thing. If we can borrow at 1% less, then we're going to have the funds available for health care. If we have to pay 1% more, then we lose those dollars to the banks. I prefer that the federal government be the one who borrows on our behalf. We're in this together, and let's keep the money working for health care.
Thank you.
You bet.
Brittany from Global.
Good afternoon, Premier Pallister, Brittany Greenside from Global News. I'm just wondering, has there been a program or an ask like this done before in Canada? Or where did this idea to go to the feds for smarter borrowing come from, and have you seen it work?
No, it hasn't been suggested before. I had a nice chat again with Chrystia Freeland, who I must say again, I thank for her willingness to be available and her openness. She says that no one else has come forward with this suggestion, but that's okay. Manitobans have led the way on ideas a lot in our history, and so maybe it's time for another good Manitoba idea. But to me, it's just common sense. You know, we're all going to be borrowing. Unless I miss my guess, the number of cases continues to rise. We're hoping to flatten the curve so that the growth rate in the number of cases starts to flatten fairly soon. We all hope that happens. But the reality is our economies have slowed down because people have to stay away from work. Some stores are closing. The dollars that are going around through trade opportunities and so on are starting to shrink. And so the revenues that governments need to support things like healthcare are starting to dry up. And so what we need to do is be able to get credit and to borrow money to make that gap, fill in that gap, if you will. And so what I'm talking about is a centralized borrowing agency to respond to this pandemic intelligently and with foresight, because different provinces are going to run into liquidity problems. As you get into a higher borrowing needs situation going forward, it may well be that you need more money, but the banks are going to charge you more for it. Whereas, if the federal government consolidates that borrowing, brings it together with their higher credit rating, they'll pay a lot less to get that money, and then they can distribute it back to the provinces who run healthcare. And that way, we'll have a stronger healthcare system, save money at the same time, which no doubt will go a long way to helping us bounce back from this thing after we beat this thing together.
I know this is something that nobody expected a few months ago, but you prided yourself on keeping your promises, and that 6%, dropping the PST down to 6%. When could Manitobans eventually now see that, and how will this affect the carbon tax?
Well, the two go together, Brittany, as you know. We believe in a flat carbon tax. I note that at least one, maybe two other provinces have already announced that out of respect for their citizens not being able to absorb a higher tax, they're slowing down their rate of increase, and that's good. More money on the kitchen tables of families is going to be needed coming through this thing if it isn't already. And so those changes will go hand in hand. What money we raise from the carbon tax will be used to help us reduce the PST so that people are made whole in our province. They're not losing money. But those changes will have to wait. Right now, we're fighting a pandemic. The responsibility for doing things like I'm proposing today is there. And again, I'd say quite clearly, this is a common sense move that can strengthen our healthcare system rather than having us pay more interest to banks.
Next is Diana from CJOB.
Yes, Diana from CJOB here. Mr. Premier, obviously, you mentioned you brought this idea forward to Mr. Freeland, but what are the next steps here? Have you spoken to other provinces about this? How do we go forward with this idea?
Yeah, great question, Diana. Thank you. I've already I've written the Prime Minister, copied all the premiers. I've spoken to two other premiers on this specific issue, and I'll be raising it on a call with the premiers this afternoon. I think we need to move forward quickly and preemptively because this thing is moving fast. And the gap between the revenues that were coming in and what's coming in now is enormous, and the need to borrow additional money is enormous. Some provinces don't have the benefit of a rainy day fund of any significant size, and they're going to be borrowing a lot more money and need to borrow it quickly. And if we can save them 1.5%, 2% on their money, that's more money that each province can use to put towards stronger health care. I think that's a powerful benefit for us as a country, and you know, Canadians expect us to work together as governments, and that's what we've been doing. This is a practical, common sense measure that can help save significant funds that we can put to higher priorities than just paying more interest to banks.
And just as a follow-up on a bit of another topic, at what point do you maybe look at scaling back to just essential services in Manitoba? At what point is that maybe on the table?
Well, we'll have something to say on that in the very near future in terms of the issues around closures and that type of thing. Our first concern is the public safety of everyone. And we all know that we have to work extra hard right now to observe all the recommended behaviors that have been put toward us to take care of our own health and those around us. I encourage Manitobans to continue to do that. But we also know that the case numbers are going to continue to rise. What we're after isn't to stop that, because that's going to happen like hopefully the water melts in the Assiniboine and Red Rivers this spring. That water is going to melt, the ice is melting, that water is coming. We just need to spread out the number of cases and reduce the growth rate. That's the key thing. The rate of growth or increase in the number of cases, so that our healthcare system can handle that, so it can adapt and respond. Our health minister and his team have been working really hard with our managers of health facilities and the frontline workers around the province in anticipation to get ready to prepare. And Manitoba has, I believe, been well served by that team of people. But now we need to also understand that we have costs associated with that. And so additional borrowing of funds is going to be an absolute certain requirement in the weeks ahead. So I think we need to get this thing set up now, get in a position so that we're able to take advantage of the lower credit costs and recycle that money right back into being able to do a better job of responding to this pandemic and eventually beating it down, and hopefully quicker rather than later.
Thank you.
You bet.
From CBC Radio Canada, Mohammed.
Hi, Mr. Premier. I would like to ask you what could be done by the province to reinforce mandatory isolation for travelers in Manitoba. Some rural municipalities has received complaints about snowbirds not complying.
Yeah, it's a concern. I think part of it is being addressed already with our Help Next Door facility that we structured in the communities. There are volunteers from over 130 communities altogether now, and thousands of Manitobans are available to help snowbirds to get the things they need without them having to go out. For example, if they have a need for a prescription, we facilitated them being able to get that prescription with help and to actually save them going and getting into contact with someone else unnecessarily and endangering them. In terms of things like basic needs, shopping, things like that, I would urge all the snowbirds as they come home to get on that website and make use of the willing support of volunteers in their community. We're coordinating that. But just this is our responsibility. It's our duty now to make sure that we slow this spread, that we flatten this curve. And snowbirds have the obligation, all of us do, to protect themselves and to protect us as well. So I encourage that. I'll have more to say tomorrow on some other initiatives we're taking to ensure that such is the case. But again, these are, I'm very impressed and proud with the response Manitobans have demonstrated. It shows we're caring people when we act accordingly, and when we protect ourselves and we protect each other. We're acting in the Manitoba way.
Thank you, Mr. Premier.
From CBC Manitoba, Bart.
The key to CBC here. Mr. Premier, how does this impending cash crunch affect your government's wariness of engaging in other financial assistance measures for Manitoba businesses and individuals?
Well, we have a number of initiatives in the planning stages right now, Bartley. I don't want to get into the details because they're just being ironed out, but I would want to assure Manitobans we're very much focused. Our principal job is to make sure the services are there for our most vulnerable people, and that we're able to protect key services, certainly to offer more services now than we have in the past with respect to things related to COVID-19 specifically. But I think also to make sure that we maintain the other services Manitobans need, because we can't lose sight of the fact that in various government departments there are other obligations we have to the people of Manitoba to keep them safe and secure as well. So our commitment is to make sure those services continue to be offered and effectively and well. We've already made over 100 different adaptations within our services to assist people in being able to access services when they need them, through new technological options that weren't there 3 weeks ago, through better partnerships among our service providers in the province, to facilitate, of course, the reduced ability of Manitobans to physically go because of the dangers to them and to others, to a government site for services, to facilitate people working from home effectively. And so we're continuing to adapt as best we can, as fast as we can. And I'm very, very impressed with the response thus far within our government services, within our public sector. But of course, there are very real pressures on us, and this is why I advanced the proposal today. Clearly, it's to me a common sense idea when you can see the need of increased need for borrowing coming our way, to make sure that we're paying as little as possible in interest, because that money could be put to better use for higher priorities right here in Manitoba.
Mr. Premier, you've spoken of Manitoba's resilience in the past, resilience to a storm. This is a tsunami, clearly. Do you think it's even possible for the province and Ottawa together to stave off a depression if we are getting into 4 or 6 months of social distancing?
Well, I don't want to jump out there on predicting anything worse than we're facing right now, Bartley. I think we all know that we've got a monumental challenge. I think Canadians are rising up and realizing that it's our job collectively, not just the government's job to solve this problem, but it's our job collectively. This is a good example, I think, of a shared responsibility. And Manitobans and Canadians are continuing to rise up and together to make sure we do the right things to flatten the curve, a phrase you're hearing a lot of, but it's very important, so that we can protect each other, so that we can protect the systems for healthcare and other services that we, all too often in the past may have taken for granted. And so I think Canadians, understand this is a team effort. But ideas like this coming forward from our government they're inspired by the common sense of, frankly, working people in our province who would very likely love to pay 1 or 2 points less on their mortgage right now, but don't have the option in most cases. In our case, if we act proactively, we can save potentially collectively billions of dollars in wasted interest that we can put towards frontline services that we prioritize more.
Next, we have Scott from the Winnipeg Sun.
Hello, Mr. Premier. Scott Bill from Winnipeg Sun. You've obviously planned for what would happen if the federal government does go through with this plan. What is the worst case scenario if they don't?
Well, I think it would be a missed opportunity, to put it mildly, so I'm going to work to make my Manitoba idea come true, because I think it just makes eminent good sense. We have a need right now, collective need, to put all our focus and all our resources on protecting people, and we have to remember that if we can do that more effectively and save ourselves billions of dollars in interest costs, and we can redirect that to do an even better job in the future, we're going to come out of this thing, and when we do, we're going to need sustainable economies coast to coast, and we're going to need governments that can provide services coast to coast, and we're not going to need or want higher taxes on everybody to pay a bunch of interest on a bunch of debt we didn't need. So if we can prevent that new debt from happening, we should do it now, not wait.
And did you talk about this? You said that you've spoken with the Prime Minister in the last few days. Have you brought this up with him, even privately?
Well, I don't talk about private conversations, Scott, but it's been raised with the Prime Minister, the Deputy Prime Minister, some other premiers. Letters gone to all the other premiers, and there's a call today, so I'll reinforce this message. But I have indication there are other premiers who would like to see this service available to them too. And again, not asking, look, we have a long-standing desire as premiers to see Ottawa step up and give us more money for health care. I'm not running away from that. We've said that we need Ottawa to be a more reliable partner on health care, but this isn't about that. This is just about facilitating us being able to borrow more money to provide health care at a lower rate. And that's what we're asking Ottawa to facilitate here. To me, it's common sense. We'll see how far common sense goes with Ottawa when they get around to responding to the proposal.
Thank you.
From the Winnipeg Free Press, Larry.
Mr. Premier, Larry Cush at the Winnipeg Free Press. So you're looking at a $10 billion budgetary shortfall for this year. I guess some of it would be increased expenses. A lot of it would be lost revenue. On the expense side, do you see it all going to health care, or do you see using some of that extra money or that money to help individual businesses and individuals themselves?
Well, two things, Larry. First of all, for clarification, about half of this $10 billion, remember, there's big, as I know understand, and I think all Canadians do, estimates during this pandemic are becoming increasingly challenging and increasingly have a plus minus attached to them. That being said, we're continuing to do them because we have to plan forward, and forward planning requires this. So on an ongoing basis, we're projecting need. I would emphasize about half of this 10 billion you just referred to would be new borrowing, and about half would be renewal of money that is maturing. So just to be clear on that point. Secondly, on the issue of programs in respect to the economy, the federal government has that principal responsibility for the national economy, and we have the secondary role of supporting their initiatives and coming up with our own specifically designed for Manitoba. I'll be announcing a couple of those in the not too distant future, but our principal concern as the deliverers of frontline healthcare is healthcare. And right now, with the pandemic continuing and growing, the concerns around healthcare are growing as well. And that is the inspiration for the bulk of the need in respect to this proposal, quite frankly, though I do anticipate there will be additional expense requirements in a number of other government departments as well.
As a follow, Mr. Premier, what would be what's your expected budgetary hit then? If it's not $10 billion, what are you looking at both on, if you combine the lost revenue and the increased expenses? How much of a hit for this fiscal year?
Well, I've just explained to you, Larry, I think the danger of this is you're going to hold me to it, and then I'm going to say it's more in 3 weeks. But our numbers right now tell us that we'll have approximately a $5 billion additional hit on top of the renewed debt that is coming our way this year. Remember that we did inherit some very fast-growing debt. In the 6 years approximately before we became government, the debt of the province of Manitoba doubled. We inherited some carry forward of that debt. And so our debt service costs right now are about $1 billion, a little over $1 billion this year. So if we have to increase our debt by an additional 5 as a consequence of the pandemic, you can do the math on the carrying charges on that with current interest rates, and you'll see that there's another $100 million, $200 million that's going to go to interest. If we can reduce those bills by tens of millions of dollars in Manitoba and by potentially hundreds of millions or even billions across the country of Canada, and leave that money in the hands of provincial governments to help healthcare survive and thrive, then we're a stronger country for that. And so that's what I'm after with this proposal.
Thank you.
You bet.
Stephanie from City News.
Mr. Premier, Stephanie Olsey with City News. You mentioned nearly $1 billion in savings in the rainy day fund. I just wondered if you could clarify what that number exactly or precisely is and how soon you could see those funds drying up.
Yeah, great question. Yeah, we had just a little over 100 million, Stephanie, when we came into power in 16. We added each year, we added some, well, think of it as the provincial piggy bank, I guess. We added more each year. This year, we should be getting very close to just a little under 900 million, but we also have identified more dollars that we can not spend on some other lower priority issues this year that we can make available. I would say at the very best, we have about 3 months of cushion. So safely by the end of June, we're into needing to borrow more money to make up for the lost revenue combined with the increased expenditures that come with this pandemic. So it's a very, very significant challenge. I would say on the magnitude, perhaps without precedent, maybe wartime, maybe the Spanish flu earlier in the last century. The healthcare costs are going to rise. We need to invest in a lot of equipment, machinery, staff time, and again, I want to be really clear. We're not asking the federal government to bail us out. What we're doing is we're asking them to help us save money on the interest costs. We're going to have to borrow a lot of money to get through this, and we must do that to strengthen our healthcare system and make it last during the pandemic and after.
We heard from the Chief Public Health Officer this morning that no penalties or fines had been handed out yet that he knows of. I'm just wondering if you can say what resources are being used to check up that people are following the rules under the public health order.
Yeah, Stephanie, sorry I don't have the call contacts and so on, but we'll get them to you. They have been distributed around to various agencies, and we're talking with business groups at a meeting tomorrow to ask their assistance. They've been wonderful, by the way. I want to say a special thank you to all our community groups and business groups. They've been amazing, helpful with ideas, suggestions, facilitating. Just to say a special kudos to the Chambers of Commerce for helping us to find childcare for our frontline emergency personnel. That's been really good program, and there's more to do there, and we thank them for helping us do it. So we want to make sure that we continue to use our partners and our allies in the community, and you in the media, quite frankly, to get our messages out as much as possible. And I'm sorry I don't have the contact numbers for this, but we'll get them out to you and reference those as we move forward.
Thank you.
You're welcome.
Steve from Canadian Press.
Hi, Premier. Steve Lambert from the Canadian Press. You mentioned the PST cut and the carbon tax. Those are now off. Are those now off indefinitely? And are you also reconsidering other tax cuts, such as the payroll tax cut?
Absolutely not. The federal government has already, as have several provinces, introduced tax reduction or tax deferment mechanisms because this is a vital way to help us get through this and to rebound and reignite our economies. Leaving more money in the small business sector, leaving more money with working families, leaving more money with seniors. All of this helps to generate and helps families and small businesses re-emerge from this challenge together. And so no, absolutely not planning on deferring beyond at the latest next year our reductions in the PST and our plan to flatten the carbon tax. And the business tax is still on the table if we can get agreement from our opposition to move on that. We believe that leaving more money with our small business sector is the smart thing to do here, not a bad thing.
And as a follow-up, some of the changes you're contemplating, I assume, will need legislation. Are you going to bring the legislature back in the next week or two on perhaps a reduced basis, like we saw in Ottawa, to bring in some emergency measures and help for businesses and individuals?
Well, emergency measures have absolutely necessitated, but not necessarily emergency measures is my coded language to you, Steve. Right now, we're all focused on protecting our frontline workers and the health care they provide to people in this pandemic. If there are measures that need to see legislative approval, we'll deal with that. I have assurances from both opposition leaders that they're ready to cooperate in that effort. And I would say thank you to them for demonstrating that. This isn't a time for partisanship. This is a time to work together in the best interests of all Manitobans and Canadians, and to do our part to assist everyone we can in the best intelligent way we can. So that's exactly what we're dedicated to do.
Are there any plans right now to bring the legislature back?
We'll make those plans when the time comes, Steve, and you'll be the first to know. I guess there's a reason they saved the best for the last on this call.
Thank you.
My pleasure. Thanks, everyone. Appreciate your work and the opportunity to speak with you today. We'll see you tomorrow.